Hello and welcome to Dr. Welling's Health Show. Today we are going to discuss about nocturnal enuresis or bedwetting in children. It is a common problem among children. While it can be really frustrating for both kids and parents, there are ways to manage the problem. So in this video, we will explore what are the common causes of bedwetting in children, and I will be offering you tips and treatments to deal with it based on my experience of last 20 years. Now, it is an involuntary voiding of urine during sleep. It's caused by a variety of things such as small bladder capacity, genetics, and even psychological factors. Children, they can be more prone to condition if there is a family history of it or if there is a lot of stress present in the home. It can be like parental fightings or arguing or even relocation. Most parents struggle with understanding how to address this issue with their children, and although some opt for medical treatments, even they try rewards and punishments to motivate the behavioral change. Others favor psychological support for their children when they are trying to manage the potential causes that are leading to bedwetting. Through proper understanding and treatment, I'm sure children can overcome this problem successfully. So to determine if your child is suffering from this problem, it is important to take into account the frequency of bedwetting, whether they have never gone through a dry spell, and their general well-being. So if your little one is wetting their bed most nights and rarely having dry spells and displaying feelings of distress during these episodes, in general, it is best that you get in touch with your doctor as soon as possible. Bedwetting can be really tricky to resolve, but there are, as I said, variety of treatments available. While many cases do disappear over time, there are some treatments available that can help your child. For example, a lot of doctors can recommend special alarm designed to wake up your child when they begin to wet the bed. Other methods include setting a regular schedule for urinating before bedtime, limiting the fluid intake, and reducing stress levels before going to sleep. In some specific cases, we advise our homeopathic combination that is specially developed to reduce nighttime urine production. The right treatment plan is likely that the most children will be able to find relief from nocturnal enuresis with time and your support. So if your child is dealing with this frustration of nocturnal enuresis, there are few steps that you can take right now. And the most importantly is to reassure them that this is a common issue among a lot of children and that they are not alone in this. Letting them know you are on their side and willing to help will be very calming for them. During potty training, refraining from criticizing or punishing your child after they have an accident like this can greatly help in reducing any emotional stress or anxiety they might be feeling due to this. Encouraging positive reinforcement such as praise them and rewards after successful night is also beneficial. Finally, encouraging lifestyle changes like avoiding beverages close to bedtime and setting regular bathroom routines before they go to sleep can have a long way in helping manage this problem. Nocturnal enuresis can have large impacts on the child's emotional well-being and even self-esteem if it persists for a long time. However, long-term effects of bedwetting may be more significant in some kids than previously suspected. Some studies suggest that untreated nocturnal enuresis can cause low self-esteem and feelings of shame not only during childhood, but it can be carried forwarded in adulthood if not addressed early on. Other possible consequences include depression, guilt, and withdrawal from activities in social situations, and even impaired academic performance in your child. So the treatment of nocturnal enuresis should always be a priority for parents to ensure their child's overall mental health and well-being, so that the mental health remains robust. I would suggest meeting our experts to address this issue at the earliest, because all our specialists are trained to handle such children with sensitivity. Finally, as we end this video, remember that nocturnal enuresis can be a frustrating condition for your child and for you both. So there are treatments available with your doctor, allopathic and homeopathic, to help manage it. So if you think your child may have nocturnal enuresis, talk to your doctor about it in time. With the right support, your child can overcome this condition and avoid any long-term consequences or effects. That's all in today's episode of Dr. Welling's Health Show. Bye and God bless you.